Coal workers' pneumoconiosis is caused due to coal inhalation. Dust reduction measures in the workplace has greatly reduced the incidence of coal workers' pneumoconiosis. The spectrum of the disease is wide. It can be simple or complicated. Anthracosis is the most innocuous form of coal-induced lung disease. These are just small black dots in the lung. This is common even in city dwellers who are exposed to air pollution. Here, under the microscope, we get to see macrophages with ingested carbon particles. If the size becomes larger and you see larger black areas or macules, it's called coal macules. And under the microscope, you see macrophages with carbon particles within them. Later on, these coal macules can increase in size and form small nodules, these palpable nodules. So they become nodules because of fibrosis. Here we see macrophages with carbon particles and collagen fibrosis. These two are together called simple coal workers pneumoconiosis, coal macules and coal nodules. If the exposure continues for years, simple coal workers pneumoconiosis can go into complicated coal workers pneumoconiosis. Here you see large black scars and the disease keeps on progressing. This is called complicated coal workers pneumoconiosis or progressive massive fibrosis. And under the microscope we can see large areas of dense collagen and pigments, carbon pigments. And there may be areas of central necrosis. Coal workers pneumoconiosis and silicosis usually affect the upper part of the lung, while asbestosis affect the lower part of the lung. So, things which come from the ground affect the upper part, while asbestos which comes from the top affects the lower part of the lung. Can help with memorizing this. Clinically, usually coal workers pneumoconiosis is benign. Only 10% of people progress to complicated coal workers pneumoconiosis or progressive massive fibrosis, which later on leads to pulmonary dysfunction and core pulmonary, or basically heart failure because of lung disease. And unlike silicosis, tuberculosis or lung cancers do not occur in coal workers pneumoconiosis. To summarize, in coal workers pneumoconiosis, we saw that at the early stages we get anthracosis or simple dots, black dots, then coal macules which progress to coal nodules where you start getting fibrosis. And after years of exposure, the simple coal workers pneumoconiosis, which includes coal macules and nodules, can progress to complicated coal workers pneumoconiosis or progressive massive fibrosis, where you get large black scars and which under the microscope shows dense collagen, lots of pigments and sometimes necrosis. And only about 10% of people with this disease go into complicated disease. And later on, this can lead to pulmonary dysfunction and core pulmonary or heart failure. And unlike silicosis, you usually don't get lung cancer or pulmonary tuberculosis here. Now let's look at silicosis. Silicosis is the most common chronic occupational disease in the world. It is currently the most common pneumoconiosis. It is caused due to exposure of lung to silica, which is a pro-inflammatory crystalline silicon dioxide. Silica is one of the most abundant minerals in the earth. It's present all over. People who are exposed to freshly cut silica are more commonly affected, like stone cutters, rock miners, people who are involved in sandblasting, construction workers, etc. Pathogenesis of silicosis same as the common pathogenesis which we discussed earlier. Macrophages, once they intake the silica, can induce the formation of inflammasome. And once this occurs, Lot of inflammatory cells come in and inflammatory mediators are released, especially interleukin 1 and interleukin 18. This causes more inflammatory cells to come to this region. This in turn leads to the production of fibrogenic cytokines, which leads to fibrosis. Fibroblasts are formed and these fibroblasts lay collagen, basically leading to fibrosis. The crystalline forms of silica are more dangerous are more fibrotic than the amorphous forms of silica. Now let's look at the morphology of silicosis. In the earlier stages, you can see pale nodules in the upper part of the lung. If it's mixed with coal, it may be black. In the long run, with more exposure, this can coalesce into larger, hard scars. Sometimes calcification occurs around these. This is called eggshell calcification. And later on, as we saw in coal workers pneumoconiosis, this can progress into progressive, massive fibrosis. And under the microscope, we see whorled collagen surrounded by silica-laden macrophages. Clinical features of silicosis is variable. Some people can progress slowly over 10 to 30 years. Some people may have accelerated progress, and in people who are exposed to a large amount of silica in a short period of time, there may be a rapid progress also. People who end up with progressive massive fibrosis will have reduced pulmonary function and later on cor pulmonale. In contrast to coal workers pneumoconiosis, here patients have increased incidence of tuberculosis and an increased incidence of lung cancers. This brings us to asbestos-related diseases. Asbestos is a pro-inflammatory crystalline hydrated silicate. Exposure to asbestos is related to a lot of different lung diseases. It can cause interstitial lung disease called asbestosis, or it can cause cancer of the lung cancer. It can cause small plaques in the pleura or even diffuse pleural plaques. Pleural effusion can also occur, and this is one of the most important causes of a malignant disease of the pleura called mesothelioma. Even laryngeal cancer can occur because of asbestos exposure. Asbestos is tightly restricted in most developed countries, but it is still used without much regulation in many countries. There are two types of asbestos: serpentine and amphibole. The amphibole one is more aerodynamic, and so it can reach the lung more efficiently, and this is the one which causes most of the lung disease. When it comes to pathogenesis of asbestosis, it's same as all other pneumoconiosis. Macrophages, once it ingests the asbestos, can form inflammasome, which brings more and more inflammatory cells into the lung, and these cells then later on produce fibrogenic cytokines, which leads to fibrosis. Now let's look at the morphology of asbestosis. Asbestosis begins at the lower part of the lung, usually in the subpleural region. In contrast, silicosis and coal workers pneumoconiosis occur at the upper parts of the lung. Here, diffuse interstitial fibrosis occurs, and because of fibrosis, the architecture of the lung is distorted. So, large air-filled areas can occur, which when combined together gives a honeycomb appearance. Pleural plaques are the most common manifestation of asbestosis. And again, if it progresses, mesothelioma which is the cancer of pleura and lung cancer, can also occur. And under the microscope, we can see asbestos bodies, which are golden colored, beaded rods or fusiform shaped things. They are basically asbestos surrounded by iron, which happens when macrophages try to ingest these asbestos bodies, and ferritin sort of surrounds this asbestos. To summarize, asbestos is a pro-inflammatory crystalline hydrated silicate which can cause a wide variety of diseases in the lung, mainly interstitial fibrosis, carcinoma of the lung, pleural plaques, pleural effusion, and even mesothelioma and laryngeal cancers. There are two types, serpentine and amphibole. Amphibole is more pathogenic. Pathogenesis is similar to other pneumoconiosis, inflammasome production, inflammatory cells, and then later on fibrosis. This is the usual progression. And under morphology, we saw that occurs mostly at the lower part of the lung, can cause honeycombing, then pleural plaques, mesothelioma, and lung cancers can occur. And under the microscope, you see asbestos bodies. So that's it. Today we looked at three most important pneumoconiosis: coal workers pneumoconiosis, silicosis, and asbestosis. All other pneumoconiosis follow similar pattern. The pathogenesis is almost similar, and all of these diseases cause interstitial fibrosis. And this brings us to the end of pulmonary pathology. Thank you for staying with me.